Welcome to HIPAA Refresher Training. This is refresher training for agents who have been working for 90 days or more. Please review the learning objectives. Let's begin with the definition of HIPAA. Health Insurance Portability and Accountability Act is a federal law that was designed to protect the private health information of patients in the new age of electronic medical records, as well as guarantee patients access to their records and the right to have them corrected. The main entities that are subject to this law are health plans, healthcare providers, healthcare clearinghouses, and their business associates, such as contract billing and coding companies. The HIPAA law applies to the Member Contact Center, because we are a health insurance plan. Here at the MCC, we must make sure that we protect the privacy of our members during each interaction we have with them. This means that we must verify some information prior to releasing any protected health information, PHI, to the caller. We must also take care to follow the HIPAA law during any written interactions, such as when we email our members. PHI is any individually identifiable health information. It is important that you as an agent understand what constitutes PHI and what is considered general information. If the caller only wants general information, you may educate the caller without verifying any HIPAA information. It is important to recognize this so that we may be advocates for access to care and not an obstacle for our callers. In the same spirit of being advocates for our members, we must also abide by the HIPAA law and protect PHI. Let's take a look at the differences. What constitutes general information? This is a list of common examples of what is considered general benefit information that does not require HIPAA verification to be released. What constitutes protected health information? PHI is any individually identifiable health information. It is any information that would allow you to recognize who the patient is and what medical services they have accessed. General benefit information is not considered PHI and can be given to the caller without any verification. Here is a list of common identifiers of health information that are considered PHI. Whose information you must verify before releasing PHI will vary on who is calling and who they want PHI about. Please review the table to understand what needs to be verified and for who. Please review the table to understand what needs to be verified and for who. When you receive a call from a member, you need to remember to do the handshake. Here is an example of an appropriate handshake.
Thank you for calling Health First Colorado. My name is. How can I help you today?
Hi, I have a question. I'm on disability, so I get Medicare. And I'm wondering, am I qualified for Medicaid as well?
Okay. So just to be clear, you just want to know if you qualify for Medicaid, correct?
Right.
You need to make sure you are speaking with the correct member. Listen to see if this agent correctly verified HIPAA information.
And how can we help you today?
I went to get a flu shot on Saturday, and they said that I was inactive.
So I understand you went to go get a flu shot, and the location you went to advised you that you're inactive in the system. I'd be happy to pull up the case and find out what's going on. Do you have your member ID number, case number, or social to pull that up?
My member ID is Paul 249843.
And your first and last name, please?
I'm Elizabeth Gonzalez.
Perfect. And Ms. Gonzalez, if you can also verify for me your date of birth and the last four of your social, please.
9/14/53 and 6154.
Perfect. And also, if you can verify for me your mailing address, please.
1933 Lima Street, Aurora, Colorado, 80010.
Perfect. And then lastly, just to verify that the number I am calling you back on is a good number to reach you at just in case we get disconnected?
Yes.
Perfect.
Here is an example of a caller who is requesting information on a member. Listen to the scenario.
Hello.
Hi, this is Jocelyn with Health First Colorado. You requested a call back. How may I help?
Yes, I'm calling in regards to my mother-in-law, Frances Kennard. We received a bill from Rocky Mountain Health Plan saying she has been dropped from her Medicaid coverage as of May, and we're wondering why.
Okay. I'd be more than happy to take a look here and see if I'm able to speak with you regarding this matter. May I have your name, please?
My name is Robert Aldring.
Okay, and may I please have Ms. Kennard's Medicaid number?
It is 000842948.
Okay, and do you see a state ID number that begins with a letter?
Yes, state ID is 0037279.
And did you say 0037379?
No, 279.
Okay, thank you. And if you give me just a moment, please. And is Ms. Kennard available for me to speak to just really briefly to get her permission?
No, Frances Kennard is in a nursing home.
Okay.
Which
And
is what's adding to the confusion because she's been approved for Colorado Medicaid and long-term care, and we have never gotten a bill for a premium for anything. So that's why we're wondering what's going on.
Okay. And I do apologize, Mr. Algene. I don't see an authorized representative here on her account. I would need her permission to access that information.
I have been her contact person since she's been here for over 6 years. I get her mail, I get her calls, and so what's going on?
Okay. What I'd be more than happy to do is to mail out an authorized representative document to her mailing address. She will need to sign it and list you as an authorized representative. Once it gets updated, we'd be more than happy to go over her Medicaid case.
Fine, go ahead.
Okay. I do appreciate that, sir. Now, if there's any general questions I can answer, I'd be more than happy to, but when it comes to specifics about her case, I don't have the ability to access that information. Any other questions or concerns?
Do you have my address to send the form to?
I have to send it to her mailing address.
Her mailing address is my address, 2691 Maya Way, Montrose, Colorado.
Okay. I do appreciate that, sir. And it will go to that address. And any other questions or concerns?
I guess not at this time.
Okay. Thank you so much for calling us here at Health First Colorado. I hope you have a good day, sir.
You too. Thanks.
Thank you, sir. Bye-bye.
Please review the summary objectives to ensure the training met those objectives. When you are finished, click Next. The department's definition of a person-centered approach is one that respects and values individual preferences, strengths, and contributions. The goal of the department's person and family-centered approach is to incorporate the value of person-centeredness into everything we do. This will ultimately improve the member experience by enabling all department employees to understand the perspectives and experiences of the people we serve. You have completed this training. Please complete the quiz before exiting the training.